Not everybody is a candidate for every procedure or treatment that you read about.
Did you bring any Botox?
I didn't bring a Botox.
If you look at the picture on the left, you may recognize this individual as a pretty well known and established politician. And I want to draw your attention to his forehead and to his eyes. And don't worry too much about the picture on the right yet. But if I saw this person as a patient and they came to talk to me about what are some of the options that I have to address the furrows in my brow, and what are the options? I hear about neurotoxins, and there's lots of different companies that make different neurotoxins, Botox and Juvo and Xeomin, and I'd like to know, are those a good option for me for these deep wrinkles?
No! No! No!
And I would tell that person that he's not. And the reason for that is if you look at the position of his brow, you'll see that it is very low. And if you look at me, I have very deep furrows in my forehead, and I personally am not a good candidate for Botox in those products either. And the reason for that is, if you think about where these lines come from, the lines come from raising your eyebrows. So as the brow drops down, we start compensating by raising our eyebrows. Over time, the skin gets folded and you get a crease. So when I see somebody like this person on the left with deep furrows and a low brow, I know that they're relying on their ability to raise their eyebrows just to basically keep them out of the way. And I do this all the time, which is why I have these deep furrows. And in me, they're very low on the forehead. That's just the way that I'm built. It is totally predictable that if you place Botox or Xeomin, it doesn't matter which product, any of the neurotoxins, into his forehead, if you now look at the picture on the right, this is totally predictable. So you can see how the middle part of his forehead is actually quite smooth. Most of his forehead is quite smooth. And then over the right eyebrow, you see this little tiny crease here, and you see how the eyebrows themselves are peaked. And some of you that are old enough will remember Star Trek. Mr. Spock had the peaked eyebrows, and that's the Spock look. And this is totally predictable, and why he, in my practice, would not be a candidate for the use of any of these neurotoxins. So what's happened here is that the product, whichever product that they use, has made the muscles totally relax, which is what those products do, which then allow the skin to relax, which lets the furrows get less deep. But in somebody who's relying on that muscle action to raise the brows out of the way, you can see how low this portion of his brow has gotten compared to where he started. So the whole central portion of his forehead has dropped, and on purpose, they have not injected as much of that product over this part of the brow to allow for some movement.
Your face.
What about it?
It's like it's frozen or something.
Oh, this. I got a Botox injection today.
But unfortunately, that translates into this very bizarre looking, like I said, the Spock look. The point of this is it's not the Botox's fault or the neurotoxin that they happen to use. Again, that's the most recognizable name, but there are 3, 4, 5 different products out there. So it's not the drug's fault. It is a medication. It is 100% technique and technician dependent. So the person who put in that product put it in certain places, and you got this result, which again, not to belabor the point, is totally predictable. So if this gentleman walked into my office and had that same concern about the furrows, one, I would use myself as an example of not using the products that he's heard about, because otherwise, obviously, I have access to those products and could be using them today. But I know that I would end up looking like the picture on the right, and I don't particularly find that very attractive. The real answer to the deep furrows in the brow position is something that we've covered before, and that is the endoscopic brow lift. And in fact, he is an outstanding candidate for that. He has a full head of hair, very thick hair, which would hide those small incisions. The brow would be placed in a much favorable position. He's got, his eyes would be more open, as opposed to the opposite of what's happened is that in fact his eyes look like they're much more hooded, much more crowded than they would have otherwise. So again, the message here is not everything that you read about and hear about is necessarily a good idea. And if you come to the facial surgery center or somebody who is able to give you the different options, you're going to be much better off and are likely to avoid the Spock look.
I don't like that. I don't think I ever did, and now I'm sure.
I hope you join me soon again. Thank you.